Hey everybody in CareSouth land, we just wanted to say hi and let you know that roads and dental are still alive and kicking. We've had some challenges with COVID-19, but we're doing our best to be creative and rise to the challenge. We've been seeing adults and children throughout the crisis for emergency procedures, but we're now transitioning into some elective procedures. Normally we see a majority of pediatric patients, but right now we'll see anybody who needs us. Please don't hesitate to come see us. We've taken measures to protect you from COVID-19, and in most cases we exceed the requirements of the CDC and the ADA. We really care about you guys, and we want you to come see us if you need us. So thank you.
Hi everyone, I'm Jeri Andrews and Director of Mobile Health and Offsite Services for CareSouth Carolina. First of all, I want to tell you a little bit about what ROADS is. ROADS is actually an acronym for Reaching Out and Delivering Services. We began providing services on our ROADS mobile units in 2015 in Chesterfield County School District. Since then, we have grown into a fleet of 3 medical mobile units, and we service 6 school districts in 59 different schools. We also have a provider on one of our mobile units, Freedom ROADS, who provides MAT services to folks with opioid use disorder on site at Rubicon Center in Hartsville and Alpha Center in Chesterfield. We'll also be expanding soon to provide telehealth services in some of our elementary schools in Dillon, Latta, and Chesterfield County. We also have a fixed site in the Rubicon Clinic. We have a provider that goes over Angela Council on Thursdays and sees clients in-house. We have an office for public service employees in Bennettsville. It's located in the Marlboro County School District Annex building on Matheson Street. Any public service employee in the area and their dependents can be seen there. So what are we doing now since obviously schools closed in March? Back in March, we pivoted our services to increase our telehealth utilization. So our providers, our nursing and support staff focused on transitioning a lot of our visits to telehealth. We did that for safety and convenience for our patients. Since March 20th through June 30th, at CareSouth Carolina, we have completed a total of 7,800 virtual visits. We also did get to provide services at some schools over the summer. We assisted with some athletic directors, provided sports physicals, well child visits on site. Since COVID-19, we have adjusted our cleaning protocols for our employee and our patients' safety. Every person that enters the unit is screened at the door, whether that's the student or the parent. They are given a mask and required to wear the mask for the duration of the visit. After every student leaves the unit, we clean with a solution that is approved for COVID-19. The solution is allowed to dry for 5 minutes before the next student comes on. We also only allow 1 student on the unit at a time with 1 parent. We plan to support our school districts as schools resume, whether virtually or in person or a mixture of both. We're available to come on site. We're also available to see your children on telehealth. So we are beginning a campaign now to reach out to some of our students who we didn't get to see last year because schools closed. So we'll be calling those parents and setting up telehealth visits so that the child doesn't miss their well visit for the year. Thank you.
Thank you.